All right, we're nearing another grim milestone in the spread of COVID-19. Nearly 175,000 Americans have died from the virus, with more than 5.5 million infected in the U.S. alone. With us now is Dr. Anand Parekh, Chief Medical Advisor at the Bipartisan Policy Center. He's a former Deputy Assistant Secretary at the Department of Health and Human Services. Doctor, I do want to get your reaction to what Democratic nominee Joe Biden said in his speech last night. How might he do it differently when it comes to COVID-19? In his first 100 days, what actions would he take differently than the Trump administration?
Brian, thank you. Well, I think he mentioned a number of things. I think the first is testing. We've actually been testing less over the last couple of weeks compared to where we had been. And if you look at the positivity rates, Brian, across the country is still higher than what we need, indicating there's insufficient testing. And so I think a focus on rapid antigen testing, getting testing out there, and so we can quickly isolate cases and quarantine contacts is, I think, one thing you heard about. You heard about universal masking and really ensuring every state in the country has a mask policy to save lives, I think is something you heard about as well. And then ensuring that healthcare professionals have what they need, the personal protective equipment to care for Americans, and ensuring that the supply chains are domestically based as much as possible. I think was a focus as well. So I think in the first 100 days, that is what we heard. Of course, in January 2021, if indeed many of these vaccine candidates are deemed to be safe and effective by the FDA, the rollout of COVID-19 vaccines is, of course, going to be a big part in terms of the next administration. It's one thing to get approval. Once you get approval, you have to do the fill and the finish. You have to do the distribution, of course, the prioritization, the administration. So the vaccine piece of this is going to be central early in 2021.
And Doctor, what do you make of this decision that we learned about yesterday, that hospitals are now going to return to reporting new cases of coronavirus to the Centers for Disease Control and Prevention instead of Health and Human Services, which it was doing? Why is that important, and what do you hope it will do?
Well, Alexis, that's a good question. I'm not really sure why they made these changes in the middle of a pandemic when hospitals were used to providing this data to the Centers for Disease Control and Prevention. So, I think all of this has created quite a bit of confusion. We all want real-time data. We need to know where we are with COVID-19 hospitalizations and deaths. And so there's a lot of trust and faith in the CDC system. Of course, systems can be improved, but I'm not surprised that they're going back to the CDC.
Doctor, is the infrastructure in place for a successful rollout of COVID-19 vaccines?
Well, that's a very good question. We do have sort of a public health and a public infrastructure. And I think what we're trying to figure out right now is what is sort of the best public sector, private sector collaboration here. First off, prioritization is critical. We're not going to be able to vaccinate the entire American public at one time. So who gets the vaccine first? Essential workers, first responders, healthcare workers, certainly those who are at highest risk, like the elderly, those who have serious chronic conditions. But then exactly how we distribute this, how we administer this, that's right now in question. And we're going to have to use the existing infrastructure, but then also see how the private sector can help.
We're seeing a number of colleges across the country roll back plans to have some in-person classes. Many of them are now moving to online as they saw outbreaks of COVID-19 on their campuses here in the early going. What should colleges be doing going forward? Does it come down to testing and testing more frequently? Do we need more of those rapid tests on campuses?
That's right, Alexis. I mean, I think the challenging part about colleges and universities, more than just K through 12 schools, are the congregate living facilities, as well as these large outdoor or indoor, gatherings. And so testing is going to be critical, not only testing before you get onto campus, but then regular testing. But at the end of the day, we're not going to be testing our way out of this issue. It's still adherence to hand hygiene, respiratory etiquette, physical distancing, universal masking is going to be so critical. And I think colleges and universities really have to tamp down very hard on behavior that doesn't adhere to these important practices. They are bringing students back onto campus. That affects the larger community. And so it's really, really important. There is shared responsibility here, but colleges and universities have responsibility. They have to crack down on anyone who's not adhering to the rules.